Slater Crusaders, America's greatest country in the world. How are you? Glad you're here. Happy whatever day it is. Seriously, what day is it? Wednesday. Happy Wednesday. Glad you're here. Let's talk about models. We've said from the jump, like 3 weeks ago, that we've been saying it for years when it comes to climate models, but models are inherently broken, flawed, incomplete, whatever word you want to use. Now, climate change models are a total joke, right? So with a model, you can make a model say whatever you want it to say, right? So you got the data, and you can, fudge that however you want to. You know what you want to end up saying. So you got the data, you know what you want. So you just create this model to come out with whatever you want to have at the end, right? You just finagle whatever you want with the model to come up with the end. So you're like, oh, you want it to say that the world's going to come to an end in 10 years because of climate change. You have this data. Let's just make the model. We'll accentuate this stuff. We'll kind of downplay this a little bit. We'll just ignore this variable completely. Oh gosh, wouldn't you know it? The temperature of the Earth is going to increase by 100 degrees in 10 years. Wow, we're all going to die, right? Like you can make a model do whatever you want. Those are climate change models. Now, epidemiologists, the models that they've been putting out recently, I don't think their motives are as nefarious. Nefarious is a strong word. As biased as some climate change modelers have been. But epidemiologists are human too, right? And there's obviously that element to it of I'm an expert, this is my time to shine. I really want people to listen. Maybe that's best case scenario, right? Like this is a big deal, and it is. I really, really want people to listen to this. So I'm going to make sure that I present a worst case scenario just to get my message out there because this is a big deal, right? So they're not tricking people. They just want people to be aware of it. And that incentive bias is going to exist. So I share that because that needs to be baked into our analysis when we look at models. Fauci recently, we played a clip of him on CNN the other day talking about the limits of models. And he's like, listen, don't hold me to this. He's like, you can make models, do whatever, don't hold me to this. And he mentioned this yesterday at the press briefing as well. He brought up the limitations of models too.
It's an obvious, very good question. If this is full mitigation and it's 100,000, why am I standing here saying I want to make it better? Because that's what the model tells you it's going to do. What we do is that every time we get more data, you feed it back in and relook at the model. Is the model really telling you what's actually going on? And again, I know my modeling colleagues are going to not be happy with me, but models are as good as the assumptions you put into them. And as we get more data, then you put it in, and that might change. So even though it says, according to the model, which is a good model that we're dealing with, this is full mitigation. As we get more data, as the weeks go by, that could be modified.
Okay. So that was a more articulate way of saying what we just said. But last point on this, and then I want to get to some models. This is Philippe Lemieux in the National Review. He was critical of the Imperial College model out of London that had like 2 million people dying. And he wrote a long analysis of it. He said, for example, the authors of the study make the hypothesis that a policy of confinement would reduce contacts outside the household, but increase contacts within the household by 25%. But why 25% rather than 50% or 75%? The authors had no reason to choose a value of 25%, but they had to choose some value, and they could not even try every value in the wide range of values that were all intuitively plausible, right? So if someone's like, I think it'll increase contacts by 25%, and someone else could go, I think it'll increase it by 50%. And they're like, okay, 50, right? I mean, like you gotta just kind of go with it after a certain point here. So knowing that, I remember yesterday we put up on the screen all like the formula that Imperial College used. And there's like 20 Greek letters, it's 3 lines long, it's like ridiculously complicated. But every variable in there can really change how it comes out in the end, right? Okay, so that being said, really good resource out there. And I'm gonna check it every day for the next couple of weeks here. I encourage you to as well. It's COVID-19, COVID 19.healthdata.org. They have their projections state by state. And they're also very transparent about their methodology is flawed, as it must be. But one variable that they make note of is that their projections are assuming strong stay-at-home orders and strong social distancing until the end of May. So we're going to show some graphs here, but when you see the peak, that assumes everyone stays put until June, until June 1st. So if we lighten up in the next month, and there could be another peak, like it peaks and it peaks again, right? Modeling is another reason because it can't account for human behavior and how people react to things over time. Now, when people change, new models would be made, right? Anyway, here's what we got. So let's do New York first, because New York is in the worst shape by far. So we got a couple good things to know. Well, I shouldn't say good. Interesting points. First, their peak, New York's peak, is April 9th. 8 days away. So they're by far the closest peak of the whole country. We'll get to that in a second. See the purple line? That is all beds. And if you look closely at the bottom there, the green line are ICU beds, and then the blue line are ventilators. So the dotted line, that's the average of the range, and you can see the faded area, that's the top of the range and then the bottom of the range for each of those different factors. So the most important thing here is, New York is so, it's hard to see on this graph because things are so bad in New York, but that purple horizontal line, that's the beds that are available. So let's just do the purple line first. Those are all the beds that are needed. That dotted line is 75,000 beds. That horizontal line are the available beds, 13,000. That's a 62,000 bed shortage. The green line down at the bottom, that's 11,000 ICU beds needed. They only have 718. That's a 10,000, almost 11,000 ICU bed shortage. Not good. The ICU bed shortage, that's where people die. Right? If you need intensive care and you can't get it, you die. The lack of beds is where you get other patients dying, right? Someone who has a heart attack or a stroke, and they go to the hospital and they're not getting the treatment that they otherwise would have. But this is also where you get the really dramatic images of the convention center full of people, and the USS Mercy full of people, and Central Park, the field hospitals, right? This is where you're gonna see this massive overflow, and that's not going to look good. But there's one thing I was going to say about the overflow. Oh, so the convention center, I've heard different numbers, but if they're short, if New York's short 62,000 beds, I've heard that the Javits Convention Center, they put anywhere between 1,000 and 3,000 beds. Now, when I hear 1,000, 3,000, like that's pretty good. Wow, that's amazing, right? I heard about a hospital in Brooklyn or something. It's like a 400-bed hospital, right? So, geez, we've increased the capacity of to 3,000 beds. They need 60,000. How are you going to get 60,000 beds? So that's a problem. Again, 8 days until the peak in New York City. Okay, that's that. Let's go to California. So California, different situation. California, so let me pull it up here on my computer. So California has flattened the curve. Remember all that talk about flattening the curve? California did it. We're not over, when it comes to the purple line first, the available beds, we're not over that line. There isn't a strong high peak. But the trade-off with that is it's over a longer period of time. California's 27 days until their peak. Now, that's bad because it's going to last a long time here, but that's the point, is because it's same number of cases, more or less, but it's stretched over a longer period of time, which keeps it under the capacity, and you can see that purple line, available beds, is well under the necessary beds is well under the available bed line in California, so that's great. Now, not as good in California is the ICU beds. It's close. And this is true with a lot of states, actually. Maybe about half the states. I've gone through all the states here. About half of them, the ICU bed line is really close to the capacity. It's just touching it, and it could go either way, and that's the range that you can see. Can you guys throw the California one up one more time? So you can see the green dotted line, it just touches up against the bottom, the top, that green horizontal line. So if things go well, then we'll have enough. If things go poorly, then yeah, we're gonna be way over that line. So we don't know. That one's touch and go. Now, California's a really big state, so things could be good. I live in San Diego. Things could be good in San Diego, and terrible in San Francisco. So really you need one of these projection graphs for every major city in California. Because if things are bad in San Francisco, I don't think San Diego is going to send up all their ventilators because we might need them here as well. So I look at this and I think California is in certainly better shape than New York, but we're still not exactly sure. But one last point on this, 27 days until the peak. And if it's a bell curve, it's 27 days till the peak and then 27 days on the other side of the peak to get back to where we are today, right? We go up the peak and then we got to go back down. So that's why we're going until June. We're gonna see this until June. And we'll talk later about a second peak coming in the fall. Okay, last one. Tennessee. So again, all the states, some states are doing really good, like Wyoming. Like they're in pretty good shape. Again, half the states are just kind of touching that line, and we'll have to see. Tennessee, I think, is in the worst shape of any other state, honestly, or at least maybe not being talked about. And I think just yesterday or 2 days ago, they issued not even a stay-at-home order, but a safe-at-home order. So I used to live in Tennessee. My wife's from Tennessee, and she talked to one of her friends yesterday and said, so are you guys like staying home? Or like, what's going on in Tennessee? And her friend's like, yeah, we're staying home. Everyone's taking it pretty seriously. I mean, I got my nails done yesterday, and we went out to dinner this weekend, but and my wife was like, well, but then you're not staying home if you're getting your nails done. That's not you guys aren't. So I think Tennessee just started taking this serious. Anyway, their projection, you can see the purple line is well over. They need projected 15,000 beds. They only have 8,000. It's a 7,000 bed shortage. And their ICU beds, bad shape. They need 2,300 projected, and they only have about 600. So it's a 1,700 ICU bed shortage. So I think Tennessee is not looking great. Other states, Colorado has a pretty big shortage. Michigan, those are the other two to watch. Two other interesting notes, and I don't have any answers to these, but Kentucky, their peak, so Tennessee is 18 days away until their peak. Just north of them in Kentucky, where are you, Kentucky? So 18 days till Tennessee, but Kentucky's 45 days until their peak. Why? How could there possibly be such a difference with two states that are right next to each other and very similar in nearly every way? That's odd. I have no idea why. And then Virginia, they're the longest. They have the longest peak. Their peak is not until May 28th. So Kentucky's May 26th, but Virginia's not until May 28th. Why? Why is the Virginia peak so much longer than any other state? 45 days. No, sorry, not 45. That's Virginia, or that's Kentucky. Virginia's 49 days until their peak. I don't know. But that's why the governor issued a stay-at-home order till June 10th. Because a lot of people are like, why are you doing it till June 10th? Well, here's the projection. Their projection is it's not going to be bad there for another 50 days. And again, another 50 days on the back end of this. So that's what we're facing here. But back to New York, it's ugly. The big storyline is it's all really close. It's all close. If the projections are a little over, then things will be okay. If the projections are under, then it could still be bad. And a long time. I'm going to take a break. But the website, again, it's covid19.healthdata.org, and you can go through and analyze your state. I want to come back and talk about the head of the CDC. The head of the CDC hasn't talked much at all, but he did an interview yesterday with some important statements. So we'll come back with that. True story, Mike Slater. Spread the word. Hey, Slater Crusaders. So we spend a lot of time on this show. We always have, before it was COVID all the time. Debunking experts. We talked a bit about this with David Harsanyi yesterday from the National Review. It's been easy to do in a lot of situations because a lot of these experts, they come out with these dire predictions that never come true, right? Climate change has done a major disservice to this pandemic and the epidemiologists, right? So for years, climate change thought, look at the models. The models, we're all gonna die. But decades they've been doing that, and everything's been fine. So then the epidemiologists come around and they're like, hey guys, look at these models here that we put together here. This is kind of concerning. And we're like, hoax. And they're like, no, we're an epidemiologist. Like, I've never heard of that. And we just ignored them for a while because we've been lied to for so many times, for so many years from the climate change experts. Climate change has done a major disservice to the expert class. For like a week, epidemiologists had to explain what they were and say, no, we're not climate change people. But even they are wrong about this, about aspects of this. We all are, right? And like, geez, if this is the first time you've heard the show, and if this is then I need to say it again, but if you've listened to the show before, you're sick of me saying this. Grace, 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 grace. It's the theme of everything we're doing right here. Every single day, it's about grace and judging corrections that people make. So I'm not critical here. It's just the reality of humans. So I'll give you an example of the experts being wrong. I read this report a couple weeks ago at the website 538. And they asked, it was something like 33 experts. I don't know, it was a bunch of experts. And they asked, this would have been on March 16th. Okay, so 2 weeks ago. They said, hey, experts, what's your range and what's your best guess on how many COVID cases we're going to have in America by March 29th? So I read the report and I didn't talk about it because I couldn't even find who they were talking to. I didn't know who the experts were. But they didn't even say what they were experts in. Like, I don't know if these guys were epidemiologists or like they were an expert in baseball trivia. Like, I had no idea. So like, what kind of report is that? I didn't think it was worthy of your time, so we ignored it. But we can look back on it now. So Chris, we play the first graph, the blue one. So you can see the lines, that's their range of guess of cases. So like best case, then worst case. That one guy had quite a range. It's like, come on, buddy. It's narrowed in a little bit. But most people had their range. And then their best estimate, that's the blue dot. So they were thinking, like 20,000 cases maybe? Right, someone guessed maybe 30,000. That one guy guessed 75,000. That was the highest estimate of how many cases we're going to have. And they were just guessing 2 weeks out. Right? So it wasn't wasn't that far of a time frame that they were making a guess. They weren't even close. Actual cases is 122,000. So most of these guys, most of these experts were guessing 20,000, and it turned out to be 122,000. So like, what good is that? Now, cases is a completely meaningless statistic because there's obviously way more cases than 122,000. That's just limited by how many tests we can give. So it was a stupid question asking anonymous experts, and they were way off. Now, I'm not critical. Again, I'm just trying to set everyone's expectations that we have for everyone and ourselves. We got to listen to the experts. Interesting balance. This is what we talked about with David Arsani yesterday. Interesting balance that we got to find between listening to the experts, but also not treating them like they're oracles with a crystal ball. And it's a very similar deal with Trump and with political leaders around the world. No country's doing this right or completely right. That's why I'm not in the criticism business during this. We all need grace and we need to judge corrections because no one's doing it completely right. Certainly not the communists in China. Everyone in the media who keeps praising the communists for, doing such an amazing job stopping its spread. Would you stop listening to the commies? But everyone else is still making mistakes. We're figuring it out. Stop holding the president to things he said months ago about the virus. I'll tell you what, I'm not going to hold these experts accountable for what they guessed 2 weeks ago and how wrong they were. So Jim Acosta, why don't you stop asking the president about things he said last month? We're all course correcting every single day. Oh, I think we got one more graph. Do you have the yellow bar graph here? So there you go. There's again how off they were. That's where they guessed cases would be about 20,000 and it was actually about 122,000. So they guessed about 20,000 cases and they were way off. Anyway, let's play this graph up here. So this is Sweden. So last week we talked about Sweden a little bit. Sweden has decided to take a laissez-faire approach to this. They're doing sort of suggested social distancing of 6 feet. Schools have still been open. You can still eat at restaurants, but you can't eat at the bar for some reason. For a while, they had no gatherings over 500 people, and I think just on Friday they changed that to no one over 50 people. But they've done way less than anyone, right? And the prime minister of Sweden said that everyone should, quote, behave as adults, whatever that even really means. But anyway, so we have some numbers now. So Sweden, Denmark, and Norway. Let's see. Norway's in blue. So these are deaths, by the way. There's a number of deaths. So Norway's in blue. They have like 30 deaths. Denmark's in red, just under 80 deaths. And then you see Sweden in yellow, about 145 deaths or so. And this was a couple days ago. So Sweden, some people in Sweden are starting to get a bit upset now. One researcher said they're leading us to catastrophe, they meaning the politicians. So we'll see. I mean, I don't know. In a way, I don't want anyone dying, obviously, but I'm glad that Sweden is doing this so that we can get a little case study. We can do a little A/B test on what happens if people do nothing versus what happened when we're doing what we're doing, right? Like, because otherwise, you're still going to have people who say, oh, if we did nothing, then it wouldn't have made a difference. And it's like, well, no, look at Sweden. They did nothing, and look how bad things were, right? So that can be helpful. I don't want anyone to get sick and die, and I don't want them to be in that situation, but at least we can look at them as an example on what to do and what not to do, lessons learned, and that's good. So we'll get a case study out of them. Unfortunately, we're also going to get a big case study out of Africa and out of India, who are in terrible trouble. And we just don't have a lot of bandwidth to talk about that. I mean, we have been, but most people don't have bandwidth to think about it because we got our own things going on. But it's going to run unabated in Africa. You can't social distance in Africa and India. What are we talking about? Did you see the pictures? I should have put this up here, but there are pictures of when India locked down the other day. It's like millions of people from neighboring countries trying to get in and trying to get home. Like nothing we've ever seen here in America. Remember we played a picture a couple weeks ago of like O'Hare Airport or something, and there were a bunch of people in line at TSA. We were like, oh, that's outrageous. There's like 1,000 times, there's like millions of people packed like, India style together. And you're like, oh, that's horrible. Like that's not good for you. Oh, I found this good. Let me pull this up here. This is good insight here. This is from a doctor in India. He said, social distancing is a privilege. It means you live in a house large enough to practice it. Hand washing is a privilege too. It means you have access to running water. Hand sanitizers are a privilege. It means you have money to buy them. Lockdowns are a privilege. It means you can afford to be at home. Most of the ways to ward off corona are accessible only to the affluent. In essence, a disease that was spread by the rich as they flew around the globe will now kill millions of the poor. All of us who are practicing social distancing and have imposed a lockdown on ourselves must appreciate how privileged we are. Most Indians won't be able to do this. It's true. So we'll know what happens we'll have a good idea of if in America, if we did nothing, what would have happened by looking at some poorer countries. By the way, we have no idea what's going on in Mexico. I'm about 20 miles from Tijuana as I sit here right now, and no one's talked about anything going on in Mexico, what the heck we're going to do with the busiest border crossing in the world. So we'll be able to look at poorer countries, and we'll also be able to look at rich Western countries like Sweden, and then learn from them. One more story here. The head of the CDC, he hasn't done a lot of appearances or interviews, but he did one with NPR the other day, and I think it's important. So probably the big takeaway from it is, there's two. The first big one is, I think the CDC is going to soon make a recommendation that everyone wears masks. I think it may get to the point where you're going to be mandated to wear them in certain places. It hasn't, like a grocery store, it hasn't been mandated because there's been a shortage of it. And they didn't want people going out and hoarding them all because we only have so many and we need people on our front lines to have them, nurses and doctors. But once people like Mike Lindell at MyPillow and so many other companies start making these, I saw New Balance is making masks and a bunch of other companies. MyPillow is making 50,000 a day, right? So once they're more available, then people will have access to them, and I think they're going to be mandated. I got to disagree. I love Dr. Victor. I think she's wonderful. We're definitely going to talk to her again. But I got to disagree with her statement yesterday on masks. I mean, her argument was that they can be used improperly. People put them on, they're touching their face, and it doesn't make that big of a difference. I don't know. It feels like common sense, doesn't it? And even if a mask, you're not wearing it properly, but even if it reduces by 50% the spread of a disease, of droplets, or your chance of inhaling it, then even if it's 10%, that's got to be better than nothing, right? So I don't know. I think it won't be mandated. It'll be very, very, very strongly suggested, which is everything that our governments have done so far. But I think there's going to be a massive public shaming effort to try and get people to wear them. This is the second big quote from the head of the CDC. He said, "The virus is going to be with us. I'm hopeful that we'll get through this first wave and have some time to prepare for the second wave. I'm hopeful that the private sector and its ingenuity and working with the government and NIH will develop a vaccine that ultimately will change the impact of the virus. But for the next 24 months, we're all in this together. Second wave? What? I feel like every day one of the most important things that we've tried to do, is to get our minds right about how long this thing's gonna last. Right? There's so many thoughts out there that we'll be back up next week. Someone wrote me yesterday. They said, we'll be back up in a week. I said, what are you, out of your mind? What planet are you living on? You're back in a week. So when people were saying days, I feel like I was saying weeks. And when people were saying weeks, I was saying months. And now I think people are saying months. And here you got the head of the CDC talking about years. Are you thinking years? The only way that we could get back, I see it, is by social tracking, and I hate it. We've talked a little bit about it, but now we have even more detail about how that could be done. So we'll talk about that next. True story. Mike Slater, spread the word. Hey, Slater Crusaders. So I've been thinking a lot about what we're gonna do at the end of this, right? So the first segment we played, we showed the graphs, and California's 26 days away from the peak, and then another 26 days, that gets us into June. Virginia's even further down. Then what, right? And the CDC, the head of the CDC is talking about a second peak coming up in the fall. So how do we get back to, right? Bill Gates the other day talked about 6 to 10 weeks. And I hear that, and after I get over the fact it's like 10 weeks, whoa, and then now we're way past even the suggestion of 10 weeks. But then what? Why is 10 weeks the end? Until there's a vaccine, until there's a cure or a vaccine, and there's promising news about a treatment, cure, vaccine's still gonna take 2 years, at least. It'd be a miracle if it was less than 2 years. I don't know, like in a very dramatic scenario, like I'm half joking here, but there's a potential, like I'm telling my kids that back in my day, people used to eat at restaurants together. And we used to shake hands when we were introduced to somebody, and we'd fly on airplanes packed in like sardines. And the kids would be like, what are you talking about? I don't think that's gonna be the case, right? We're gonna get a vaccine eventually, but I don't know what the near future looks like. Remember a week or so ago, we shared a graph from Imperial College London talking about, it went out till next November. And their idea was that every state, every country, lets people go back out into the wild. And then once ICU admissions ramp back up to a certain point, then we lock down again until they go back down. And then when they go back down to a certain point, we let everybody back out again. And then, right? So it does this at like a lower level. And the end result was we're quarantined for 2/3 of the year and out and about for 1/3. And you're like, what are you, out of your mind? It's like, what is that? Who's gonna live life like that? You're locked up for 2/3 of the year. So I think the only way out, again, barring a vaccine or a cure, the only way out is gonna be the government tracking your every move. I know we've talked about this a bit, but I got even more detail here. So the Google already knows this. They know everywhere you've ever been. This would not be hard to implement, right? Of all the logistical challenges that we're facing right now, making ventilators and masks, getting the tests made and accurate and out there to millions of people, making a vaccine. There's all these like legitimate logistical hurdles. Tracking your every move is not one of them. That can be done. It's already done. Not even can be. That is done right now. So just go to Google, Google Maps, click on the menu in the upper left-hand corner and just scroll down and it says My Timeline, and just click it and it'll show you every place you've ever been. Has the map of the country or the world if you've been around the world, but the map of the country with all these red dots, you click on each red dot and it'll tell you exactly when you were there. So I clicked on Vegas and it said you were there on Sunday, December 29th, 2013. It tells me when my plane landed, when I got in the cab, when I got to the hotel, every place we went to eat. It knows everything going back for like a decade. So they already track everywhere you go. It's right there, it's not even a secret. Asian countries are doing this. We talked about this a week or so ago. Singapore has a website that tells you every single person who has COVID, where they're located, where their home is, where they work, where they've been. We played a video last week of a woman traveling around China. She has to check in everywhere she goes. Her cell phone has data that she gives to the officials there that tell her where she's been the last 14 days. She can go anywhere if she has a green card that allows her to travel through different areas, right? You down with all that? You okay with that? Every time on my show for years we've talked about self-driving cars, I always get someone calling in, a lot of people calling in, saying, I don't want the government to know where I'm going, right? And it's like, man, Google already does. I'm not saying that's right, but just so you know, Google already does. And maybe people were right to be concerned about that, but this, I have fear that people are just gonna be like, yeah, take it all. I don't know. So, there's one more thing. Washington Post, a couple days ago, I don't think we talked about this one. They put data out on how much each state has social distanced. And it was a color-coded map based off of percentage decrease in distance traveled. So they could compare how much people are driving now, today, versus 2 weeks ago, last month ago. The company's called Unicast, UNACAST. Have you ever heard of Unicast? Never heard of them. How do they have all the data from everyone's cell phone? For months, right? Enough to have a baseline number of how much you've traveled versus how much you're traveling now. All right, so this data of how people are traveling, it's not like they put people on overpass, like over the highway, like overpasses, like counting cars that go by. They're following your cell phone data and your locations. I would show you that map, but we're gonna kick it up a notch here because that map from that company is nothing compared to this right here. Check this out.
We wanted to see the true footprint social gatherings like spring break beach crowds could really have on our society in the face of a global pandemic. To do so, we started with the big picture, powering our engine with billions of anonymized location data points from mobile devices across the globe. Using tectonics, we can then zoom in on specific regions. Here, we focus specifically on just one beach in Fort Lauderdale during the month of March. Again, each of these data points shown on the map corresponds to a unique mobile device active on a given day. You can see clearly that device activity spikes during the 2-week stretch of early to mid-March corresponding with spring break. No surprise. Now, using an analysis called a spider query, we can actually track movement of these devices over the remaining weeks of March, seeing where these devices went after spring breakers left the beach. As we zoom further and further out, it becomes clear just how massive the potential impact just one single beach gathering can have in spreading this virus across our nation. It can be hard for us to realize sometimes just how connected our world really is, until the data tells the stories that we just can't see.
So let me first on the point he wants us to get is it's amazing how far people travel in no time, right? And how far a virus can spread from one beach in Fort Lauderdale. And that's the point that he wants us to make, and that point is well received. But also, what the heck? How can they track our cell phone data like that and know that you were on a beach in Florida 1 minute and now you're back home in Chicago and everywhere you've been in between? That's crazy. You don't think the government's gonna do that? You don't think the government's gonna track that data and find out who has COVID, test who has COVID, and then put those two data points together and find out where that person has traveled and then who they've been around? Of course they're gonna do that. Let's play one more video. This is the same thing, New York City.
This week, policymakers across the country took definitive actions to enforce social distancing policies in their own states. We wanted to take a look at the real footprint that just one major metropolitan hub could have on the United States in the face of the COVID-19 crisis. We started with New York City and honed in on the epicenter of Manhattan and surrounding areas. By doing a quick spider query, we can then zoom out to the rest of the United States to see where these mobile devices traveled after this 2-week stretch. As you can see, in just 2 days following the analysis that we ran, these mobile devices traveled from New York City all the way across our country and throughout the world.
That's amazing. Spider query. I had to make it even more scary sounding. We weren't going to do a whole segment on this, but it just reminded me. I saw this post from some Instagram influencer, And they live in New York City. It's this woman with husband and wife with 5 kids in New York City, Manhattan. And they're out. They got an RV. They all hopped in the RV and they're out of here. And people are super critical of them for leaving and potentially spreading, right? Because if everyone does that, then we'll have to do another spider query to find out where all these people go. And they're going from the biggest, worst hotspot in the country to wherever, and they're gonna spread it even more. I heard that story and I thought, where the heck did you get an RV in Manhattan? How do you get one of those? Because I'd be out of there in a second too. I'm not gonna blame her for doing that, but we can follow individual people, and find out how they're spreading this disease. So it's pretty amazing and also potentially terrifying technology. Maybe the only case I can imagine this being terribly useful would be a pandemic. So David Gottlieb? I know it's Dr. Gottlieb. Why did I call him David Gottlieb? I don't know if that's his first name or not. It might be. He was the former head of the FDA. He's been everywhere. That was the first time that's happened. My cell phone ringing. Sorry about that. Spam too. Jeez. He put out this report on phase 2 and phase 3, what that looks like getting back to normal. So phase 3 is we have a vaccine, so we can go back to normal. Phase 2 is, he says every state, and Bill Gates disagrees with this. Bill Gates says it has to be nationwide or nothing, because people travel in between states, unless you're stopping people from traveling in between states. But phase 2 is every state needs to fulfill every one of these requirements. And there's like 6 of them. And one of them is the state is able to conduct active monitoring of confirmed cases and their contacts. Active monitoring, that's what we're talking about there. So you're not only tracked, but you have to be tracked prior, right? So you're not only tracked, like once you get tested and you have it, the government's not gonna be like, okay, now we're gonna track everywhere you go. That's not it. It's, oh, we've been tracking you, and now we know everywhere you've been the previous 2 weeks, and then some. So then they can send an alert to everywhere you've been, to everyone who's been everywhere you've been, so that maybe they need to quarantine or watch out, right? So let's flip it around. Let's say you're not the one who gets sick. Let's say you're healthy, and you have a green pass or bracelet or whatever dystopian thing we're gonna come up with, and you get a text from the CDC. And it says, you were at the dry cleaners 4 days ago, and you were at the dry cleaner 5 minutes after someone who just tested positive for COVID. You now need to go on a 14-day quarantine. That's what, I mean, I don't know, what else do you think when they say active monitoring? What else could that be if not that? The technology's there, and the question is, are we going to accept that in America? I was talking to a friend of mine about this, and he said they'd have to start it as an opt-in. You'd have to opt into being tracked, opt into receiving alerts if you've been near a COVID patient. So the question is, would you opt in? I don't think that's how they'll do it, though. I don't think that's how I'm sure they will just do it. And I think young people in particular, where privacy is not even a virtue, privacy is not a value to younger people. They're purposely putting their life out into the world. That's the only thing they've ever known. I think young people will sign up for this without even thinking twice. Older folks, more privacy-minded people, I don't think they're going to be as quick to. Would you? True story. Mike Slater will wrap up next. Spread the word. Hey, Slater Crusaders. So in other news, which is something I haven't said in a month, Tom Coburn passed away. Former Senator Tom Coburn from Oklahoma. He was 72. A former staffer wrote this about him, and I share this because we've been talking about leadership lately. And the book, The Captain Class, it's a great book, and talks about the captains of the great sports teams. They're not the highest paid player. They're not the MVP. They're not the person who sells the most jerseys. They're the unsung heroes on the team, but they're the actual captain. So this guy talked about all the different true aspects of great leaders, of great captains. And one of them is motivates others with passionate, non-verbal displays. So Courtney Shadegg, she said that Dr. Coburn once had a middle seat in the last row of a flight. She said seat assignments, because senators fly so much, seat assignments are gold to senators. She said, I was horrified and I apologized, right? So they're at the airport. She gets the ticket. It's last row, middle seat. They can't change it. She's embarrassed. She has to go tell him, hand him the ticket. You can imagine, she's like, oh, Dr. Colbert, I'm so sorry, Senator. Oh, please don't be mad at me, blah, 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 blah. He replied, it's okay. My ego needed a middle seat last row. Everyone needs that now and then. And she said, I don't think I felt the same about the middle seat since. That's how you inspire people to follow you. It's what you do. That's leadership. I'll end with this point, similarly. So the other day, I, stupidly or not, I don't know, put some money in the stock market, like an E-Trade account. I've never done that before. Like I have my money in the stock market, but I've never done like, I'm gonna buy this stock. Right? I'm not even gonna tell you what it was, what I put it in, because like I don't want you coming back at me and being like, well, Slater told me to invest in the Cracker Barrel and I lost all my money. Like I'm in no position to do that, all right? So I'm not gonna tell you what it is. But I've been dabbling in the day trading business. And it was kind of fun for a day. And now it's exhausting. And I'm done, I'm out. Being a day trader sounds terrible. And I literally did it for 2 days. It's not for me. So now I'm on set it and forget it mode, like the Ronco food dehydrator. I'm set it, forget it. We'll see how it ends up. So in the midst of me doing this goofy process, I came across this post from Seth Godin. And he wrote a post about day trading emotions. He said, when the stock market's on an upward tear, day trading becomes more popular, right? Because you sit in your basement, you're surrounded by, all the tickers and everything, and you're looking, hopefully, buy, sell, make the most profit based on what's happening at this very instant, this very moment. And now you can watch like the cents to the penny go up and down. And he said, it's pretty tempting also to day trade your emotions. We've piped in voices. This is Seth, Mr. Godin. He says, we've piped in voices of a billion different people into our brains. And it's the loudest and angriest and most frightened people who are the ones who are amplified the most. Everyone's sharing what's breaking and the visceral angst of this very moment over and over and over again, nonstop all day. And this is the key line. He says, just as it's almost impossible to make a profit as a day trader, it's difficult to be happy when you day trade emotions. How have you been last few weeks? Have you been day trading your emotions? I have. I'm done with the show and I go see my wife and she says, what are you now? Like number. Remember I do this like number system, like between 1 and 10, 1 being not serious, 10 being super serious. She's like, I'm on like a daily, like sometimes I'm a 4. I got down to a 3 the other day. Sometimes I'm a 7. I think right now I'm a 5, whatever. Right, but like that's how day tradey I am with my emotions. I'm more obsessed with the news than ever before, more obsessed with Twitter than ever before. My wife and I, most of our conversations are about COVID, and that's fine because it's kind of a big thing going on right now. But it's more of like, what's the latest? Like that's our mindset, and that's tiring. Now, Mr. Godin, he has a solution. He says there's an alternative. Buy and hold. Stand for something, stick with it. Long-term contributions matter. Let's try and buy and hold our emotions through this period. Because again, my number one point, whenever I talk about how long this is going to last, my goal is just to get our minds right with all this. And that's an emotional thing too, right? Like what are our emotions going to be for the next few weeks and now months, maybe even years of this, right? It's so, like I say that so we don't go on wild emotional swings. Because the person who thinks this is going to be over in a week, when week 2, 3, 4, 5, 6, 7, 8, 9, 10 rolls around, they're going to go crazy. But you're like, you know what? I know this is going to last a couple months. And then when week 6, 7, 8, 9, 10 rolls around, you're prepared for that. You're not going to go on wild emotional swings. The stock market may be, but you're not. So I'm not making light of anything that's happening, right? Like there's people dying and there's jobs being lost and businesses being lost, and like being lost in a really unjust way too, right? Like if you're going to go out of business, I want it to be done because of my failures, right? Like my mistakes, or my competitor did it better, right? I don't want the government to mandate that no one can go to my store and that's what causes me to go out of business. So it's all very unjust too. But if you can, I think it's easy for me to say too. My family were good, I'm on salary, right? So it's all easy for me to say, I get it. But if you can try to buy and hold your emotions, then I think you're going to be better off. And maybe also, or definitely also, buy and hold your faith. So we need humility. We need to fight our tribal urges, our political tribal urges. We need to embrace the uncertainty of the moment. We've got to be patient. We've got to assume the best with each other because we're all trying to figure it out. Give yourself grace. Things are going to get more strange before they get more normal. And I've said this a million times, but today, you are more clear-headed and less stressed than you may be at any time in the next few weeks or months. So take advantage of your clarity, make good decisions, and I'll leave you with Numbers 14:18. The Lord is slow to anger, abounding in love, and forgiving sin and rebellion. Slow to anger, abounding in love. So must we. See you tomorrow, Slater Crusaders. Spread the word.